Good afternoon to members of the media and our listening and viewing audience on this feed. Thank you for being with us, and both Dr. Rishi Sitaran and myself and the UNC team wish you all a healthy, happy, and wonderful 2023 and beyond. With me this afternoon is Dr. Richard Sitaran, and it is a wonderful thing for the former Member of Parliament, myself, to introduce my colleague, the present Member of Parliament for Caroni East. Dr. Rishi Sitaran is a very distinguished dental surgeon in the field for many, many years. So we are here today on behalf of the Opposition United National Congress, which is the government in waiting, and on behalf of the Honorable Leader of the Opposition, the next Prime Minister-to-be, to respond to Prime Minister Rowley's news conference today on the latest COVID-19 threat, and he held this meeting this morning. First and foremost, nothing Prime Minister Rowley says at this present time concerning the very serious local, regional, and global COVID-19 threat we once again face can be taken seriously. Nothing that Prime Minister Rowley says at this present time can be taken seriously. In fact, I received some calls this afternoon on my way down here from several people who asked me, Tim, what you thought about Prime Minister Rowley press conference this morning. I said, well, what do you think? And unanimously all said to me, it was a waste of time, a total waste of people's time once more. They have been through this for 3 years, and he presided over 4,200 deaths of our citizens. So what has he said new? In fact, today's newspaper showed the Daily Express. Business groups fear stricter measures as COVID cases rise. And they advised the Prime Minister, don't lock down Trinidad and Tobago. Prime Minister, pandemic team addresses country today. So the population had become so weary and tired of all the shenanigans and so on of Prime Minister Rowley and his team, that the population is now in fear. And this is what the Guardian is saying now. Not again. Citizens brace for Prime Minister's COVID statement. Stakeholders hope no restrictions will come. So both daily newspapers, and Newsday also has some important aspects of it, have in fact been asking the question, what would the Prime Minister say today? And in fact, he has said absolutely nothing. I'll be going to that in a while, a little more in detail. We say that he is really saying nothing and doing nothing because the key reason for this is that he's once more relying on the same failed propaganda team of ministry officials who presided over 4,200 plus COVID-19 deaths in Trinidad and Tobago since 2020. And this morning we saw the same thing coming around again after 3 years. This same type of rubbish and foolishness, with one showing charts and different color ink. This one showing the same thing about number of COVID positive patients in parallel healthcare system. And this is what they occupy the time of the people of Trinidad and Tobago for the last 3 years. At press conferences or media conferences where they said absolutely nothing. And this is what the epidemiologists put out again, which means absolutely nothing to patients, to citizens of Trinidad and Tobago, when particularly they want to know how they're going to be managed, God forbid, that some member of the family get the virus or is very ill with it. So we have once more this failed propaganda team of ministry officials who presided over 4,200 plus COVID-19 deaths since 2020. This is the same failed, incompetent, disastrous team which advised prolonged draconian lockdowns, causing nearly complete destruction of our economy. Citizens are aware of that. Thousands of job losses, over 100,000 jobs lost. They wiped up so many small and medium-sized businesses. They condemned two generations of children to lose out on their education and fall way behind in perhaps irretrievable ways. So education had been destroyed. The lives of citizens had been destroyed. Businesses had been destroyed. So this is the same failed, incompetent team who managed for 3 years, or mismanaged, which advised unconstitutional closure of our borders, causing thousands of citizens to be stateless and homeless. I want the population to remember that this is the same Prime Minister Rowley and his team who caused thousands of citizens to be stateless and homeless, practically stranded in foreign countries. So the newspaper article today showed exactly why they fear whether Prime Minister Rowley will do this again. And he just stayed short of saying it. He said, not at this time, not at this time. Be careful. This is the same failed, disastrous team that advocated the citizens of the country be stripped of their constitutional rights when it came to freedom to practice their religious beliefs and final rights. We must remember that. This is the same failed, disastrous team of health officials led by the perennially incompetent Health Minister Terence Singh, which got condemned for their failure to manage the COVID-19 crisis in the Seamongal report. This, ladies and gentlemen, is the report of the committee appointed to investigate the factors contributing to clinical outcomes of COVID-19 patients in Trinidad and Tobago. And with it, almost 19 recommendations, and none of these recommendations has been dealt with and addressed by the minister and his team at the ministry. And this is the same failed, disastrous team of health officials who continue to come back onto the television, and one person presiding over 4,000 deaths, receiving an order of the Republic of Trinidad and Tobago. This is only in Trinidad and Tobago this can happen. What politicians do for political sake is bewildering. Order of the Republic of Trinidad and Tobago, Shakonia gold medals for presiding over the loss of lives of 4,200 citizens, thousands of whom could have been saved. And this is what he's coming back with again, Prime Minister Rowley. And it was only when the leader of the opposition and myself included and the United National Congress relentlessly pressed him for an inquiry into the COVID-19 deaths in Trinidad and Tobago, he eventually succumbed and appointed a team. And we were ranked as the highest incidence of infection and deaths per million population in the world. Remember, Minister Singh was saying, we are number one in the world. We are the number one in the world taking care of COVID. Unfortunately, we were number one in the world in terms of deaths per million population. So for the record, let me make this clear. The opposition United National Congress is against any lockdown of the country whatsoever. The leader of the opposition says that she is opposed to any lockdown of the country whatsoever. And we cannot trust Prime Minister Rowley. He's speaking at the present time. He's speaking about what is happening between now and Carnival at this time. He has never said what is a possibility beyond that. You cannot trust him. He's not a person to be trusted. So businesses are now beginning to recover, and they will collapse entirely if this is to occur. The newspapers spoke about it today. Nowhere in the world, not even in China, which had the longest lockdown, etc., is this happening anymore. So we warn Prime Minister Rowley and his team exactly what the Express said there and the Guardian: don't lock down Trinidad and Tobago. Thousands of citizens have been suffering and are suffering. We are against any type of border shutdown. So you may say you're not doing anything now, but we have to look at you because you're not for somebody to be trusted. The country must be open to all businesses at all times. And we, the leader of the opposition and the United National Congress, and all of us are against mandatory mask wearing. Though we urge citizens to take all personal precautions, which they had been doing, such as washing hands, sanitizing, keeping distances wherever acceptable, and even wearing their masks on their own discretion, but it should not be made mandatory. We are against mandatory vaccines, but we urge the government to bring about a strong education program. The government has failed for 3.5 years to bring out any proper education program to change the minds and the mindset of almost 49% of the population which have not been vaccinated as to why they should have been vaccinated. And we in the United National Congress call on those unvaccinated to come forward and protect your families and protect your lives with the vaccination, whichever one is available, and make sure that you can reduce the chances of becoming very seriously ill if you get the infection, and your life can be saved. So we call on the 49% of the population to get vaccinated. So we are against mandatory vaccines. So we urge the government to get the drugs and the vaccines and make them available to the population. We heard the minister this morning speaking about the amount of Sinopharm and Johnson & Johnson vaccine available. And we still have questions about the Sinopharm vaccine. How much did they purchase from China? At what cost did they purchase it? At what agreement? I remember there was $100 million that they said that China will give to Trinidad and Tobago if we purchase the vaccine. So is this one of the reasons why we have the 200,000 plus vaccines at the moment? Where are the AstraZeneca and the Pfizer vaccines and the pediatric doses of these drugs? Where the minister alluded this morning that parents were asking for the Pfizer vaccines for their children. Why can't we have some? What is the inefficiency and inability of the government to be able to bring this in? And MP for Caroni East, Dr. Sicharan have been speaking and asking for Paxlovid for more than 1.5 years. And where is that now? Where is the purchase of the Paxlovid, which can save lives? So we have a situation where we don't want patients to become ill, but God forbid they become ill. Where is the Paxlovid to help them get over the problem? Where is the Toxilumab? Where is the Remdesivir? And where is the methylprednisolone? Where is the dexamethasone? All these drugs are to become available. And whether Minister Dayal Singh and his team are ankara with that, because none of these 4 medical personnel, have worked more than 1 or 2 years maximum in a public institution to understand the clinical care of patients. The fact is that though Prime Minister Rowley may say otherwise, we simply cannot trust him to keep his word whatsoever. He may say no lockdown now, but he's the same man who said he was not shutting down Petrotrin. You remember one day he said, we are not shutting down Petrotrin. And 2 days later, a few days later, we are shutting down Petrotrin. Is that a prime minister you can trust? So he's telling the population something here today. And just after Carnival, watch him to see what he will do. He's therefore using this COVID-19 upsurge as a convenient distraction. And just like he did in 2020 and 21, up to last year in 2022, he will want to use COVID as a convenient distraction and as a weapon to hide and conceal his failed leadership and government. Just like he did before, he will want to use COVID-19 as an excuse to shut down the country because he cannot run the country in any way. 600 murders, cannot take care of the population which have experienced flooding. The country is collapsing. Citizens are unable to feed themselves. Children's education have become worse. It's the worst in the education system since I know about. It's the worst performance ever. 9,000 children writing SEA failed to get more than 30%. And what is alarming, you see the Minister of Education recently saying 2022 was the best education, the best report on education ever. So I think these people have to be dreaming when the whole country knows that it was the worst performance in education ever in the history of Trinidad and Tobago. Is Prime Minister Rowley a man who prefers to keep a disastrous team, who oversaw the deaths of over 4,200 citizens, and who to date have done nothing to implement the recommendations of the Seamongal report, than to act in the best interests of the citizens of this country? That was his modus operandi from the outset. The United National Congress, since January 30th, 2020, 3 years ago, called for discussions in Parliament under a matter of urgent public importance, 3 times in the lower house, twice in the upper house, 5 times. They refused every last call we made from when the death toll in COVID hit 600 to take concrete action to save lives. Imagine how many lives of our citizens could have been saved if this government, the Rowley government, had just listened to the United National Congress from the outset, from January 30th, 2020. Hundreds and possibly thousands of lives would have been saved. Let me say this afternoon, by keeping this team, Prime Minister Rowley shows he's a callous coward who refuses to do his constitutional duty as Prime Minister and guarantee citizens their constitutional right to safety and proper health care. Every single COVID-19 death in this country was a result of criminal negligence from the failed health authorities and in the regional health authorities. And Prime Minister Rowley is shamelessly putting us once more in this position with this failed team and with the same failed minister. And we call for the removal of this team and the removal of the Minister of Education. And in fact, Prime Minister, the people are calling for your removal as well. So hear that. The people are calling for your removal. You are the head. And you have a failed Minister of Health, and you have a failed medical team who presided over 4,200 deaths. And let me go straight into the Seamongal report and just speak a little about it. In fact, and this is a damning condemnation on the performance of this team, the Ministry of Education team, Ministry of Health team. The first point, data management system, data verification. They said the hallmark of a modern healthcare system is information management. In accessing data, for example, the patient records, there is an urgent need for electronic medical records. The ambulance transfer database, community care database, and the hospital care database need to be urgently linked to support cost-effective and oriented patient outcome. That is the first of 19 recommendations made by the Seamongal Committee of very distinguished professionals. So if Prime Minister Rowley wants to really become serious about this COVID issue, bring about and appoint a team of top professionals who know what clinical management is about. And you're relying on the same, the same type of people in the primary healthcare system. Primary healthcare system people, they are not well trained in clinical medicine. And so you have a team of people there who are not understanding the necessity for clinical care and good medical outcomes. So bring in the best, get the best to come forward. And as I'm on that point, when are you going to begin to bring in the other stakeholders, namely the business sector, education sector, other members of the health sector, and other interest groups in this country to give you some assistance in putting forward a position policy on the future management starting from tomorrow, today. You need to bring in these stakeholders and start and make sure you have a good position paper and a policy paper for implementation to prevent the loss of these amount of lives that we had in the 3 years. The second point, NCD management under the Simongal report. The high rates of NCDs among the patients who died or who were hospitalized for COVID-19 were notable. More attention needs to be paid from a young age to the prevention and management of NCDs to ensure that our citizens become and remain healthy. Preventive management needs to be aimed at children, adolescents, and young adults. A national survey of NCDs is urgently required, and the data used to guide the review and revision of health promotion and treatment programs. The Prime Minister and his team spoke today, or tried to speak, about NCDs, and they categorized the NCDs as diabetes, hypertension, asthma, cancer, etc. We all know that. Can the Minister of Health tell this population what is the incidence of diabetes in the population? What is the incidence of hypertension? What is the incidence of cancer? What is the death rate of patients without COVID from diabetes and hypertension? What is the death rate from cancer? No, not one in the 7 years, not one of the Ministry of Health personnel can give that information. Neither is it available on CSO. So Prime Minister Rowley, for you to manage and talk about NCDs, which the Simongal report is telling you to engage in, you don't know the beginning of where we need to start. What is the incidence? What age groups you have it? How are you going to manage them? So it seems as though when someone gets COVID, because they have an NCD, diabetes or hypertension, and they were categorizing, well, this death with three NCDs and 3 comorbidities, as though you're putting these patients to die because they have these comorbidities. That cannot be acceptable. And you're putting patients to die after the 65 or 70 with comorbidities. And you're putting patients to die. This is what you have to deal with immediately. The third point, the clinical staff who have been hired temporarily and whose contracts would be continued at the end of the pandemic should be redeployed to respond to the NCD morbidity debt than that has accumulated during this pandemic. So when Dr. Richard speaks about parallel healthcare system, that parallel healthcare system, nobody really knows it's a single health system. It has been an abysmal failure. Those 3 years, thousands of citizens requiring urgent surgical procedures were left with their tumors growing and becoming worse and dying. Thousands of citizens who needed management for their diabetes and hypertension from the clinics and the hospitals and the health centers, their diabetes and hypertension became worse. And when therefore they got COVID, the system, they were unmanageable to some extent because of what you say is your parallel healthcare system, which was not working properly and which did not satisfy the health requirements of the population. So, and then Dr. Richard is speaking today about a hybrid system. What is this hybrid system? So that's a new thing that you have put into the climate of the management of COVID. They don't seem to know what it is they're doing and what it is they really want. And the other points, dedication of frontline staff. Some RHAs, some of the staff in the frontline felt abandoned by the leadership. Supplies from C40, that is the center which houses the drug. We recommend that C40 should be continuously open 7 days per week. It was not. Drugs were short, patients were dying. Oxygen. We recommend that the oxygen requirements of all large institutions be reviewed with consideration of purchasing oxygen concentrators. I want to remind the population of what happened in Point Porter Hospital one night, where there were over 20 plus patients having difficulty in receiving oxygen because the oxygen supply faltered. And still today, the Minister of Health has not answered the question, how many patients in Point Porter Hospital died that night as a result of lack of oxygen. In the 10th Sir Williams Medical Sciences Complex, there were no oxygen cylinders. Oxygen cylinders ran out, and patients were left there suffocating for want of oxygen when oxygen was not available. Oxygen supply on the wards were not available. So what has D.L. Singh and the Ministry of Health and the Prime Minister done about these recommendations on the Simangal report? Not one has been touched. They talk about the mental health support, job security. Short locum and lack of job security took a mental health toll on young doctors and young nurses. We recommend that such staff should be given contracts for a minimum 1 year. Meals, you remember we spoke about the people getting breakfast at lunchtime and some not getting any meals. Communications with patients. Families were waiting 3 days to hear about their loved ones in the institution, only to be told that their family died, and come and visit the family, come and look for the family in the mortuary. When they go there in the mortuary, the bodies are not even there. What about the empathy accommodation? When the doctors work hard, the nurses work hard, their accommodation was terrible. Sites within hospital where demise occurs. Imagine the Simangal report is telling the Minister of Health and his team, you don't even know where these patients died, whether they died in the corridor, whether they died in the ambulance, or the HDU, or the ICU, or the wards. Imagine you presiding, this medical team presiding over the management of COVID, and they can't, the task force appointed can't even find out where these patients died. In fact, they asked for just 300 notes, and they were given 30 notes to look and examine what they have. They deliberately hid information from this committee, and today it is shameful, disrespectful to the population. And we have been asking about the other drugs of Toxilumab and Remdesivir and so on. And they spoke about, the Simangal report spoke about the national policy regarding ICU admissions and care of the elderly. It was noted that 15.2% of pediatric admissions went to ICU, compared with only 1.2% of persons over 80 years of age. This was remarkable given the high death rates among the elderly. So, in fact, it seems as though this team of professionals wanted those of 80 years and above not to be in the intensive care unit. And so this Simangal report said, we did not find any mention of a national policy regarding admissions to ICU for persons of different ages, and recommend that such a policy needs to be articulated. And they spoke about the views of the relatives and so on, and the relatives were pained to speak about their loved ones in the institution. So, Dr. Rowley, if he is serious and not looking for a distraction from crime and the Pariah Commission of Inquiry into the diverse deaths, and the public outcry against his PNM puppet presidential elect, Prime Minister Rowley must immediately remove this failed health team and appoint a team of qualified, independent, professional medical practitioners with consensus from the Parliament. He must also state categorically and upfront his plans for education of the population, what he is going to do about border control, lockdown, and pledge to ensure that no child is suffering from shutdowns, no citizen is left stranded and stateless, and business people are not left scrambling to survive. He must hold immediate public consultations on these issues with all relevant stakeholders to get consensus and to promise them he will not destroy our country. So, the United National Congress, the government in waiting, the Prime Minister-to-be, Mrs. Kamala Prasad-Bissessar, myself, Dr. C. Charan, and our UNC team all pledge our support towards the management of this COVID situation in Trinidad now and in the future. We give you our assurance that we will work with you and we will give you advice and support that would be very professional. And we know we have the competence and the ability from within our team to be able to give you that support. But you refused that support for 3 years. And you had one of the worst teams to supervise the whole management of this COVID. And I want to remind Dr. Rowley that I remember him saying at one time, you must listen to Dr. Gopi Singh in one of these meetings that he had. He's a man of experience in the medical field and so on for a long time, and you must listen to him. He said I was a very experienced doctor, and appealed to the population to follow my COVID-19 advice. So I want you to follow my advice, Dr. Rowley. We are willing to assist you. And we want to let you know that we are not spiteful, we are not petty. We have served our country in public life, many of us in medicine and sports and academia and so on, and we stand ready and willing to offer our immense experience. So this is not a time for ego. Our nation's economy, health, and social fabric are at stake, as evidenced by the newspaper's front page articles today. It is a time for consensus and action, and effective action. After all, we are all in this together. So Prime Minister Rowley, please do right by the citizens of this country, and let us work together to save their lives and our nation's and children's future. So, ladies and gentlemen, there's more we can speak about, but my colleague, Dr. Sitaran, who has been championing the cause in Parliament as well on this COVID issue, I now hand over to the distinguished Dr. Richard Sitaran.
Thank you very much, Dr. Gopi Singh, my political mentor, the man that actually brought me into the United National Congress. And I would like to add, he's a world-renowned physician and specialist. And thank you for your very, very insightful contribution, Dr. Gopi Singh.
Pleasure.
So good afternoon, everyone, and thank you for joining the United National Congress today as we respond to the Prime Minister's media briefing held earlier this morning at the Diplomatic Center. I would like to begin with Dr. Gopi Singh by thanking all healthcare workers that have done yeoman service to this country in the treatment of COVID-19 patients for the last 3 years, and their service continues. It is a fact that our nation is experiencing an uptick in COVID-19 confirmed cases and deaths in the last 4 weeks. According to the Ministry of Health's last update, and in fact what I learned from this morning, there are currently 71 persons in hospital and 5 persons in the intensive care unit as we speak. This is compared to 17 persons in the first week of December 2022. There have also been 8 deaths over the past week, compared to just 1 death in the first week of December 2022. And there have been 406 new cases of COVID-19 over the past week, as compared to 151 new cases in the first week of December 2022. That gives us roughly a 7-day rolling average of 58 new cases per day. And the CMO actually told us that this morning, and quite alarmingly, Dr. Avery Hines says that there's an increase in the positivity of COVID-19 tests, and he projects in coming weeks that the daily number of COVID-19 cases can go into the hundreds as we approach Carnival and beyond. Once again, we are faced with the prospect of our elderly and immunocompromised citizens being under threat of hospitalization. Currently, we are roughly 51% fully vaccinated in our twin island republic, and many hundreds of thousands of citizens have also contracted COVID-19 over the last 3 years. This means that many in our population would have developed some substantial level of immunity to the novel coronavirus, which can be termed as a hybrid immunity. But the virus continues to evolve and continues to adapt to the immunity suffered by vaccines and infection. We were told today that the Omicron subvariant XBB.1.5 or the Kraken is in our midst, and we may soon have to face this coronavirus variant in some form or fashion. Professor Carrington told us that there have been 4 confirmed cases of this variant thus far, the first case being on the 10th of December 2022. My question to the health team is, why was the public not told of this earlier? We are now being told after 1 month that this new highly transmissible variant is in our country, and this information could have been used before the Christmas holidays and many persons gathered with their families and loved ones in a Christmas setting. Many persons who have died from COVID-19 over the last month could actually have been saved if we knew this highly transmissible variant was in our midst before the Christmas season. There's also the fact that our borders are open to international travelers from the US, where this strain is the most dominant form of the coronavirus on the eastern seaboard. Without a doubt, we will soon be engulfed with this dominant strain of COVID-19 as we approach the Carnival season, and it poses a significant threat to our vulnerable. My question to the health team is, how exactly are we going to manage these cases given that the mother of all carnivals are upon us? Where are the therapeutics? Prime Minister Rowley has said this morning that we may be facing a different situation in the aftermath of Carnival, and this is something that we must take very close notice of. With Dr. Gopi Singh, I would like to state that the United National Congress, under the leadership of Kamla Prasad Bisesa, is firmly against any plans by Prime Minister Rowley and the incompetent Minister Dayal Singh and his health team to partially or fully lock down citizens of Trinidad and Tobago now and in the future. After 4,297 deaths in a population of 1.4 million, Prime Minister Rowley now wants to tell us that the incompetent Minister Dayal Singh and his team can manage this outbreak into the Carnival season and beyond. To do so, many steps would have had to be completed already, such as the procurement of vaccines for the vulnerable, the procurement of antivirals for those already infected, and the hiring of additional health personnel to man our nation wards. To the best of my knowledge, this has not been done. Prime Minister Rowley and his incompetent team were once again sleeping on the job, unable to prepare for the eventuality that this may occur, and instead going into the phase of COVID-19 is done, it's time to give out awards and distribute grants. The entire health team has many questions to answer, and they will have to account for their actions and inactions in the not too distant future. Thousands have died who did not have to die. We have the highest death per capita ratio in the Caribbean, as Dr. Gopi Singh said. We are near the bottom of the list in the ranking of COVID-19 countries globally. This is after billions were spent on new hospitals that lacked the appropriate drugs, the appropriate equipment, and health personnel. Where have all the billions gone? Rat-infested step-up and step-down facilities. Citizens were forced to stay in under the threat of jail and fines. Doctors begging for gloves, masks, oxygen tanks, as Dr. Gopi Singh said, to do their job. Many decisions made by this government were not in the best interest of this country. Remember when Prime Minister Rowley said all who want to go to Tobago could go, and everybody went and infected our sister island? Tobago went from 4 deaths in March of 2021 to over 287 deaths currently, less than 2 years later. Most of these deaths could have been prevented if Prime Minister Rowley allowed the vulnerable in Tobago to get vaccinated. Let the record show that Kamla Prasad Bisesa and the United National Congress is in full support of Carnival. This is an economic money-making machine for this country. The nation needs every economic boost it could get after the Rowley administration decimated livelihoods of thousands of citizens of this country. Should cases rise to a dangerous level once again, Kamla Persad-Bissessar and the United National Congress will resist any attempt by this Rowley administration to lock down this country because of the incompetence of Minister Dayal Singh and his health team. We will also resist any attempt to enforce a mass mandate on citizens outside a medical setting. What is the point of giving citizens a fine for not wearing a mask when the government apparently has no intention of collecting it? Tens of millions of dollars in fines, $26 million are yet to be collected. The Rowley administration is making fools out of everyone in that process. Illogical rules like wearing a mask with your wife and son in a car, or otherwise you'll get a fine. But everybody going to the same house to sit on the same couch to watch television without a mask. They were making it up as they went along, and it was you, the public, that had to hold strain. Today, under the leadership of Kamla Persad-Bissessar, we are calling for the dismissal of the incompetent Minister Dayal Singh and his entire health team. The dismissal, they have left the vulnerable in society unprotected, and more experienced doctors should take their place. May I remind you of the incessant health restrictions and the closure of businesses under the directive of this Minister of Health? Many thousands lost their livelihood because of the policies of Minister Dayal Singh and his health team, and many thousands have still not fully recovered. This Rowley administration even banned the doubles vendor from making a living. Do you know that it is almost impossible to contract COVID-19 in an outdoor setting? Under this Minister of Health, all fast food outlets had to close, and that meant many persons were without an income. Bars were closed. Persons couldn't visit the beach or rivers. Where else in God's green earth did a population undergo restrictions such as this, besides in countries ruled by despots and dictators? Without a doubt, our nation's highest murder tally was achieved directly because of the suffering caused by the Rowley administration. It was the most oppressive system of restrictions in the Caribbean, and the population reacted to it, and they still are. And then there are the children that struggled because of the closure of schools, as Dr. Gopi Singh stated. We still have not assessed the impact of those draconian lockdowns on our student population and the disadvantage faced by thousands as classes went virtual. Society will have to face these children who may not be able to recover academically in a few years, all because of Rowley's policies. My question to Minister Dayal Singh and his health team after this very long press briefing this morning: how many of Professor Simongal's recommendations have been implemented by Minister Dayal Singh and his health team?
None.
Has the Ministry of Health undertaken any remedial steps to rectify many of the issues raised by the acclaimed professor and his equally illustrious team? Have staff shortages from the level of executive management to doctors and nurses to orderlies to patient escorts been addressed? Do doctors still have to do non-medical jobs like lifting and moving patients? Will doctors and nurses be overworked to the point of exhaustion, as happened during previous surges? Has privacy concerns been addressed of young female and male doctors sleeping in the same room on a mattress on the floor? Would nurses have to work long hours in PPE without a break, or unable to drink water or go to the bathroom because of staff shortages? Do young doctors still have to cope with very short locum contracts of 1 month or 3 months in duration, or have they already been dismissed? would there be as much as six ventilated patients per nurse and up to 30 warded patients per nurse? Did Minister Dayal Singh and his health team even consider procuring and purchasing tocilizumab, an immunosuppressive drug approved for the treatment of COVID-19 and in scarce supply in our hospitals? And what about shortages of midazolam, methylprednisolone, and propofol? It is my understanding that not one of these recommendations have been acted upon. The Rowley administration has learned nothing from past experiences. Nothing was said by this health team this morning on how they will save persons facing the ICU and HCU. Are we just admitting these vulnerable persons in our society to die? Are we just about palliative care and not about management and saving persons' lives? Not to mention, the only vaccines available to those who may want to boost their immunity against the virus are the Sinopharm vaccine and the Johnson & Johnson vaccine. In the Express editorial of 10th January 2023, they called for a greater variety of vaccines for those in the public that may want to avail themselves for a shot. It was the Express's way, a nice way of saying, where are the boosters, Minister? I must also state that Kamla Persad-Bissessar and the United National Congress are against any form of forced vaccination on any person in this country. But those who are elderly and immunocompromised deserve the best protection available to save their life should they choose to take it. All of our Pfizer and AstraZeneca vaccines have expired many months ago. Even our pediatric citizens in this country, those under the age of 16, do not have access to a vaccine right now, and we are facing a surge of COVID-19 cases. And Minister Dayal Singh and his health team have not undertaken to acquire new stock. During the Standing Finance Committee in October 2022, I implored Minister Dayal Singh to acquire these newly reformulated COVID-19 vaccines tailored specifically for the Omicron variant of the coronavirus. And he told me flat out the Ministry of Health was not interested in purchasing these vaccines at the time. Had we acquired these WHO-approved vaccines through purchase or donation, many of our elderly and immunocompromised citizens would have access to the best possible treatment options internationally to protect themselves from an evolving threat. I reject the assertion this morning that we do not need to procure these vaccines. And I would like to just make the simple analogy. Every single year, the flu vaccine changes and the formulation changes due to an evolving threat. And what they do every year is they formulate a new flu vaccine to combat the dominant strain that they predict that will be circulating in the populations. So if we can use a new flu vaccine every year, why can't we acquire the new COVID-19 vaccines? We are now facing a potential surge of the COVID-19 virus, and we only have the old Sinopharm vaccines, which were tailored against the Wuhan strain from 2019, and the Johnson & Johnson vaccines. I have spoke extensively in the past about the Johnson & Johnson vaccine. I will not go into that right now. But it is a fact that the Sinopharm vaccine, while effective against the original strain of the coronavirus from 2019, has a much reduced efficacy against the highly contagious Omicron subvariant XBB 1.5, which has surged to more than 80% of COVID-19 cases in the northeastern United States, and it has the potential to spread quickly as hundreds of American citizens make their way here for the Carnival festivities. Again, I make the call to Minister Dayal Singh to acquire, either through purchase or donation, an adequate supply of reformulated COVID-19 booster vaccines from Pfizer or Moderna. The WHO has stated that anyone over the age of 60 years and having already received 2 doses of the Sinopharm vaccine should be offered an extra 3rd dose. And this is very important for those who have taken 2 doses of the Sinopharm vaccine and feel that they have enough immunity to fight the COVID-19 virus. The Strategic Advisory Group of Experts on Immunization recommendations has since stated that this 3rd shot should not be considered a booster shot, but as a 3rd dose of a primary series offered to certain groups to meet the acceptable immunity threshold. And what this means is that if you're over 60 years of age, or if you are somehow immunocompromised, you need 3 shots of the Sinopharm vaccine to attain a certain level of immunity that is acceptable by the WHO. The panel also recommended that persons with weakened immune systems should also receive a 3rd Sinopharm vaccine. The question must not be asked, given the fact that the WHO made its recommendation since May of 2021, why did Minister Dayal Singh wait till January 2023 to appeal to those over 60 and the immunocompromised to get their 3rd shot of Sinopharm? Many lives could have been saved if the Minister of Health continued a public health education program targeting those identified by the WHO that would need a 3rd shot. Minister, a mall drive in 2023 on the weekends is a pathetic attempt to catch up. And the TSAT alert message is similar. In fact, in first world countries, they are using telemedicine, whereby should you test positive for COVID-19, they ask you to stay home, they ship antigen tests to you, they ship Paxlovid and other drugs to your house, and they actually call you and check up on you every 12 hours. That is the stage they have reached in first world countries, Minister Dayal Singh. It should also be noted that Minister Dayal Singh and his team has also refused, as Dr. Gopi Singh said, to order the antiviral drug Paxlovid made by Pfizer and used around the world as the gold standard in treating persons newly infected with COVID-19. Paxlovid, and I have said this many times already, has been shown to reduce the risk of hospitalization and death in 88% of persons when given within 5 days of the start of symptoms. That means approximately 9 out of 10 persons who have died in the last 4 weeks could have been alive if they had access to this drug. It has also been shown to save 100% of vaccinated persons if they take this drug when newly infected. It is available in every single pharmacy in the United States. Could we have not asked for a small supply for our tiny nation, from our great friend and ally, the United States? This therapeutic will save lives as well as reduce the strain on hospital admissions. Many months ago, the CMO, Dr. Parasram, is on record of saying a cost-benefit analysis would have to be done to determine the feasibility of purchasing Paxlovid. CMO, how many more must die from COVID-19 before you actually acquire this drug as a therapeutic here in Trinidad and Tobago? The Rowley administration has reversed all the gains of the Kamla Prasad government in the public healthcare system. The government from 2010 to 2015 initiated unparalleled service at all refurbished 105 health centers around this country. In addition, the state-of-the-art Cuba Hospital and San Fernando Teaching Hospital were introduced, and construction began on the general hospitals at Arima and Point Fortin. Kamla Prasad Bisesta added over 700 hospital beds to the nation's public healthcare system under her tenure. Improved healthcare was given to babies, women, and infants. Infant mortality was greatly reduced. Patients benefited from cardiac care, dialysis treatment, and other forms of medical service. World-class facilities were built and were being outfitted with modern equipment, adequate pharmaceuticals, and competent and skilled professionals. Before I close, I would like to make another statement here. Dr. Parasram said today that persons are allowed to break quarantine to get a COVID-19 test. I would like to ask Dr. Parasram, is this in the legislation? Can someone who is under quarantine orders leave quarantine and tell a police officer that they are just going for a test? And I would like the Attorney General to please comment on this statement. How low can we go? The answer must go. I thank you very much.
Thank you very much, Dr. Richard Sitcharan, for going into the depth in terms of the medication that is needed and the whole management of the COVID-19 rise in infection, which Prime Minister Rowley spoke about today. And if we were to just make a few brief comments and an analysis of his contribution to the country today, which many termed a waste of time, he said that there is nervousness in the country. Well, of course, there must be nervousness in the country because, as Dr. Sitcharan mentioned, and we all are aware that there is increasing infection of this XBB 1.5 infection in the country, which is predominant in the United States. So it is going to be increasing in Trinidad. And then he mentioned they didn't know enough of the virus and the vaccines and the medical treatment and so on when it came into Trinidad. Dr. Rowley, 1 year after, still did not know anything what was supposed to have been done. So it took him almost about a year while hundreds of patients died in that time while they were on the learning curve. He said the response in Trinidad and Tobago will be guided by science and public health specialists. We want to tell Dr. Rowley, you have to change your team. It's guided by science, but the team is not giving you the proper scientific advice, and therefore you have to bring in the best professionals that Trinidad and Tobago can offer you, and there are hundreds of them willing to give you the help. Then he said they're winding down the parallel health system. There was never a parallel health system, so you couldn't wind down anything. Then he said the Ministry of Health had remained absorbed in changes. As Dr. Sitcharan said, can Prime Minister Rowley tell us what changes he has made, in fact, in the health sector over the last year, particularly since this COVID had been reduced to a certain extent? What has he done? And you mentioned a number of things which should be looked at critically and which have not been done, as evidenced in the Simonga report. And then he said the level of infection has gone up. He is accepting that it is going up. The population is vaccinated to a significant level. Is he comfortable with 49% of the population unvaccinated? Where is the education program to try and convince these citizens that they ought to be vaccinated? Have you shown them the reasons why they really should go and get the vaccines? So they had been faltering from day one on the education program. He said government and cabinet continue to monitor. Monitor what? What have they done? What have they found? What did he say in terms of what are they doing about after they monitor the situation? And the same team is using, he said, 5 experts led by Roshan Parasram. Well, Dr. Parasram, you presided over 4,200 deaths in this country as the chief medical officer. History will never forgive you. And as we said, a commission of inquiry is going to come. And you have 95% deaths in the intensive care unit. What did you do about that? And when we began to ask you questions about it, you failed to answer it. You never answered what you were doing about the increasing deaths in the ICU. And the nurses told you there was one nurse to about 3 or 4 patients in the ICU. 6. Yeah. There was one nurse to 30 patients on a ward. There were junior doctors in the ICU, no senior doctors working with them. They had shortage of staff of nurses and doctors, as Dr. Sitcharan said. So, and then they come with a new capacity with the hybrid system. The parallel healthcare system is a laughing matter. What was parallel? We spoke about that just a while ago. It means then that you're supposed to have a system looking after the COVID patients and a system working efficiently and effectively for management of the rest of the country with all their diabetes and hypertension and cancer. And as we keep on re-emphasizing, that did not occur. Patients' health became worse and they died as a result of those problems. And Then they said they're coming next week with media briefs again. So the country is going to be bombarded with this foolishness on a weekly basis from Parashram et al., Parashram and Hines and their team with this stupidness on a regular basis. Is this education? Why don't you take the time to go and visit the institutions and see what are missing and what are required to take care of the patients when hopefully it doesn't happen, but if it does happen, with an increased workload in the ICU and on the wards and so on. The other issue, he knows that over the last month, there has been increased demand for care. 5 patients in the ICU now. As Dr. Citron said, where are the drugs to take care of these patients? Where is the clinical staff? Where is the competence needed to take care? Are you going to condemn these 5 patients in the ICU to their demise? Yeah. So they're seeing increased demand for hospital care, but they refuse to implement any of the recommendations that both of us spoke about that are in the Simongal report to improve healthcare. They don't care about this. Dr. Rowley, because it was condemnatory on his management of the COVID, he has failed to introduce any of these measures and implement all these measures. And as Dr. Citron said about the small drive and so on. So Dr. Rowley, in summary comments this morning, he said, in the synopsis of the situation in Trinidad and Tobago outside of basic situation does not warrant any intervention. Imagine that he says it does not warrant intervention. When there is increased infection, it doesn't warrant any intervention. He said data presented by Dr. Hines facing prospects, even though he said that data presented by Dr. Hines facing prospects of increase in levels of COVID. And he said that it doesn't warrant intervention, even though that is happening. And he said they're not approaching this phase by trying to shut out citizens and so on. Not a necessary response at this time. Closing borders. Those drastic actions are just not required now. Closure of schools. Shut down borders, not at this time. So we want the population, and we need to examine what is happening and the work that they are doing on a regular basis. And we really want to see the last of this team, of incompetent personnel on this team, and mismanagement of the entire COVID situation in Trinidad and Tobago.
Continued mismanagement.
Continued mismanagement.
Okay, we have some questions, Doc. Why, you mentioned the Simongal report, why hasn't the recommendations been implemented as yet?
I think it's a slap in the face for Prime Minister Rowley and his team, because they probably feel offended by the findings on this report. They're probably being obstinate and not deciding to implement any of the recommendations made of the 19 recommendations. So it shows the spite and the hate and the insensitivity of this government and the callousness in dealing with the population. They don't care. Prime Minister Rowley doesn't care, really. He only cares about his self-image and how people see him. And well, his image is the worst that you can find for any prime minister. So from crime, 600 murders, to joblessness, to loss of businesses, closure of businesses, the worst performance in school, the worst situation in health. I ask anybody to go to Port of Spain Hospital at the accident and emergency, and you will see dozens of trolleys with patients almost dying on the trolleys there. They don't know where they are. Nobody looking after them. More than 50 to 60 patients there. And this is just one area within the health sector. Minister Dayal Singh has been a failure, and he has presided over the deaths of thousands of citizens in this country over the 7-year period. And he should be forthwith removed. We call on Prime Minister Rowley, remove Minister Dayal Singh, remove Minister Hines, and in fact, think about removing yourself and calling an election, because the people are fed up. The people, everywhere you go, people are they're in pain, they're in grief. They cannot get a job. They cannot provide for their families. They cannot send their children to school. They cannot take care of their households. Some citizens in this country, they have to starve for a day. Some of them missing meals. You can imagine. I wonder if Dr. Rowley goes out on the field and or rather just goes to Tobago and play golf or at Mocha and just don't bother with what people are saying outside there. Put yourself in that position, Prime Minister Rowley, of these people. Don't you see their suffering and their pain? What are you doing about it? If you cannot run this country anymore, get out. Call an election. But you want to bring in kangaroo court in this country, and the people are really uptight about the whole situation, what you're doing about the constitutional rights and the constitutionality and so on. You're making this, as Senator Mark said, this is a Papa Doc country. You're Papa Doc, and you're continuing with your style of totalitarianism and autocracy. What I say goes. You remember, as one of his former leaders said that if you don't like it, get out. One of his former colleagues. So, ladies and gentlemen, if there are no more questions, we bring this evening's proceedings and media briefing to an end. And thank you very much for viewing. We appreciate you looking and analyzing what we have said, and we appreciate your feedback from time to time. Join us on our way forward to relieving this country of this totalitarian and autocratic government of Prime Minister Rowley. We thank you very kindly.
Okay.
Are you ready to feel the beat of soca? Are you ready to feel the beat of chutney? One stage unites the spirit of Carnival. Saturday, 4th February. One people, one beat, one night. I love Joker. Come.
When we drinking, rough when we whining. When we start to drink, we get fiery. Like thunder we rolling, from night till the morning. So they can't talk to we. Are you ready to party? Are you ready to fete like this? Raise up your cups and your glasses. If you think you could drink like me, meet me by the bar, cause we taking shots. Middle of the fete, everybody just taking shots. Link up with me, everybody come take a shot. Middle of the stage, there's only ladies and shots. Yeah, so take a shot. Whoa.
Chutney steam. I hear what chutney steam. Brandon Center, you ready for the tempo? I hear what chutney steam. I hear what chutney steam. Don't stop. Chop your back, call your wine so unique. Take charge, so I love it how you roll with the beat. Love it how you roll with the beat. Roll with the beat. Chop your back, call your wine so unique. Take charge, so I love it how you roll with the beat. Love it how you roll.
Are you ready to feel the beat of soca? Are you ready to feel the beat of chutney? One stage unites the spirit of Carnival. Saturday, 4th February. One people, one beat, one night. I love Joker. Come feel the beats.